we're going to talk about something very important now, and this is something very dear to my heart. It's about safe sleeping. Now, there's a lot of information that circulates about how to safely sleep your baby. And there's a lot of things that can help your baby to sleep. But what we're really going to focus on is just the key fundamentals to avoid sudden infant death syndrome, which is called SIDS. And we're going to ask the experts to take us through those key points. So if you're busy, this is the most important message we have for you about raising your baby, right? So let's talk about what is SIDS,
Okay.
and how do we avoid it?
So one of the first things we need to talk about is the sudden unexpected death of an infant. There are many reasons why infants pass away, but one of the reasons is SIDS, so sudden infant death syndrome. So the statistics are, in 1989, what happened was the Australian government actually started this campaign to encourage, because the sudden infant death syndromes are actually quite high within Australia, the numbers. And so what they came up with these campaigns to actually encourage a certain routine, certain things that we recommend mums and families try in hope that these numbers and deaths actually were reduced. So over a period, so that was in 1989, they had many campaigns running, and they certainly had different things that Haley and I will talk about in a sec that recommend that families do. So in 2018, the actual drop in sudden infant death syndrome was 85% due to the introduction of these campaigns. And that alone is enough for me to say, it's working. Let's keep doing this. Let's do the tips that Haley and I are going to show you, because it actually shows 85% reduction from 1989 when they started the campaigns to now is huge. It's evidence that it's working.
Yes.
So what exactly do we recommend with regards to reducing the risk of sudden infant death in a baby? So
there's many of them. So first and foremost is definitely sleeping baby only on their back.
Yes.
So first of all, so not on their tummy, not on their side, on their back. One of the big questions that you do get families asking is if they're worried about, if they're on their back, they're worried that the baby will, if they vomit, they'll choke. But if you look at a baby that's positioned on their back, they generally have their head turned to the side, which is they're naturally clearing their airway when they are positioned that way. Yeah. So definitely on their back is first and foremost. Right. So secondly, always have them on a flat, firm surface, so not on an incline.
Okay.
So if we look at like an incline, like if we look at a newborn baby, and their anatomy is the big reason why they need to be flat. The main reason is because babies are very head heavy. Right. So if you in that curved position, their head falls forward.
And bring them chin to chest.
Yeah, exactly. Yeah. That's right. So their head will fall forward. So, and that will basically, increases the risk of occluding airways, and reducing the oxygen supply. Yeah. So it can increase the incidence of SIDS. So definitely on their back, with no incline.
Is there any, so we get this question a lot, because
Right.
a lot of you ask us to create mattresses and products that incline, and we've always said that it's not something we will do. So it's really important to us to explain to you why.
Right.
Is there, because a lot of you tell us that your doctors or your friend or family member that is an expert in this area has recommended it. Is there any time that you would recommend for a child to be put onto an incline, a newborn baby to be put onto an incline?
The only time that we recommend that is if the baby is in a special care nursery environment. So somewhere where there's a professional person that is actually there watching that baby 24/7.
And they're monitored.
Yes.
Yes.
Because what happens when a baby is on incline, for example, the anatomy the actual trachea, which is the part that goes into the lungs, is actually lying above the actual esophagus, which goes into the stomach of the baby. So if a baby actually, if we have our baby flat like this, if the baby does a bit of a vomit, so the esophagus is down, the stomach's down here and the lungs up here, if the baby does a vomit, it actually sits in the bottom of this little bucket sort of area that it sits in, and then the baby tilts its head and it goes away. If the baby was on its tummy, it would be this way round. So the baby does a bit of a vomit, and the actual vomit, the little bucket is on the top, not on the bottom catching it, will actually go down into that windpipe, and that is why babies can asphyxiate, because it's actually going down towards that. Does that make sense?
Right.
So anatomy actually makes a huge difference to that positioning. And also, they say that 50% of babies, that are younger than 3 months, it's actually quite normal for babies to regurgitate. That is huge. You know, people are so worried. My baby's vomiting all the time. My baby's, spitting up all the time. It's actually quite normal for 50% of babies that are below 3 months of age to actually spit up. It's quite normal. And for babies, it's 70% normal for babies up to 12 months of age. So this is where you see that babies after 3 months, they'll do lots more spitting up.
It's normal. So ladies, really the messaging here is really clear. Always flat on their back.
Yes.
So unless they are in hospital, monitored with care and with pipes and with a professional,
That's right.
at no stage should you be inclining your baby. So adjusting your mattresses or putting in little extra bits and pieces or trying to lift your baby's head in any way, because we know that they should be flat on the back.
Yes,
Now, currently the Australian standard doesn't actually address this, but if you look to other regions like New Zealand and Canada, they actually have banned incline products. So I believe that this is a direction we are heading in, and it really needs to happen sooner than later, because we can see the problem with incline products, and there are so many in the market, and there's a lot of parents creating their own products or creating their own conditions for inclining products. It's really not safe. So this is a really important topic, because this is a very topical issue right now.
Yeah. And incline positions when a baby's asleep, one of the risk factors is that the baby can actually slip down under the bed covers and actually suffocate as well.
Oh, yes,
So
of course.
this is another reason. It's not just the anatomy, it's actually that physically this baby can actually wiggle down or slide down. So that's why it's only if the baby's monitored and 100% by specialized
So we're saying
people.
flat on their back.
Yeah.
What is the other tips you have for us?
Nice firm mattress.
Yes.
So it's lovely, like nice and flat and firm. We mentioned just briefly before about don't add anything into your cot. So don't add anything that helps with that incline. No toys, bumpers, anything like that. Anything that's added to the cot can prove to be a potential hazard. That your baby could suffocate on, things like that. So nothing else in the cot with the baby. Wrap nice and snug, so no loose bedding as well that potentially include airways and suffocate.
So no excessive bedding.
Exactly.
Yes,
That's right.
Okay.
Positioned at the very bottom of the cot as well. So not at the top of the cot. Again, if they're positioned at the top of the cot, they can wiggle underneath blankets and suffocate. But also by positioning up at the bottom of the cot, it increases the airflow around their head.
Fantastic. So we're going to do a little demo, and we're going to show you how to properly and safely sleep baby. Flat on their back, no incline, and no excessive bedding, so we know they're nice and safe, nice and firm their mattress should be. Now, no culturally, let's talk about this firm mattress, because we get a lot of people ask us to make special mattresses for them that are soft. It's a really big no-no. So we won't make them, but people do shop around for soft mattresses. And I understand culturally, from some cultures, there's this idea that soft mattresses are nice and cuddly and comfortable, but they're actually not safe. Can we explain to parents why? Because I think if we understand why, so from what I understood is the reasons why, but I'd like the experts to tell us exactly why we wouldn't have a soft mattress.
So basically it's just to keep that baby on the back itself. So the baby doesn't sink down into anything, so no bedding gutters into the mattress as well. And it actually encourages the flow through the mattress as well and around the bubby. So yeah, we recommend definitely it needs to be firm. It encourages the anatomy to sit properly as well. So baby is not, let's say you've got a softer mattress, that the neck isn't tilted and therefore occluding the airway. There are many different things that can actually cause the anatomy of bubby to stop that breathing. And SIDS, one of the things about SIDS is that the experts actually don't know what causes it.
Yes.
That is very important for us to know. But remember what I said earlier on, 85%, because of the information that Haley and I are outlining in yourself, it is quite, it's big evidence because it actually reduced the numbers of the sudden infant death by 85%. So it's working.
It is working.
It's working.
It is working. And because we have heard there are other things that we can avoid doing, and that there's some things in our control and they're not. So there's some studies we've seen that genetics play a role as well.
Yes.
But so do things like the environment, like smoking. Yes.
Smoking's definitely on that list as well.
So
that we recommend. That was in the campaign.
Yeah. Breastfeeding, as I mentioned before, can help reduce the incidence of SIDS. And the other big one is ensure the baby's head is uncovered. So no bonnets or beanies or anything like that on their head while they sleep.
And hair ties.
Yes.
Hair ties. Yeah.
I noticed that they're beautiful and Royal babies are beautiful. Hair ties, but all these beautiful little hair pieces are not meant for babies when they're
sleeping,
and really, not really meant for newborn babies at all because they sleep all the time.
That's right.
And it's so true. So anything that you add can potentially be a hazard. So things like hair ties, bonnets, beanies, even like the little teething necklaces you see, right, as well.
So no teething necklaces.
No.
Anything, you don't want anything around around their neck that could, either cut off the oxygen supply.
So one of the things I feel is really important to note here, and I'm sure you see this, because in practice we will set up our nurseries to be this really amazing safe space. We'll learn how to settle baby, and then we really, unfortunately, without thinking it through, we'll put baby in a compromising position by taking them to the couch, for example, or under our quilts. Now, a lot of unfortunately, if we look at the last couple of years of those that have suffered as a result of SIDS, the circumstances of a lot of the coroner's reports are saying that they happened in places where baby doesn't normally sleep.
Yes.
So it's really not just being conscious of the place that baby sleeps, so having the safe cot, knowing how to properly sleep baby, but it's also where you take baby out of that environment and say, for example, in their car capsule.
Yes.
So in their car seat, which is often a capsule for a lot of mamas, it puts them chin to chest.
Absolutely, yeah.
Thinking about those sorts of things, having them in the bed with us with our quilts and with all the excessive bedding, and a lot of us love lots of pillows, right, ladies? So we love our pillows, and some of the dads do too. So, those sorts of things I imagine are very important to think about, not just setting your nursery up to be safe, but all the spaces that you potentially think you're going to take baby into. They all need to be equally safe.
Exactly. And it is. It's so true. It's about thinking about every possible scenario. And the other big thing is that the SIDS recommendations to reduce the incidence of it is for them to have their own sleep space.
Yes.
That's the other thing we haven't mentioned is, so generally the SIDS recommendations are for baby to sleep in their own cot or bassinet in the mother's and the parents' rooms.
Right.
So if you do get the baby out for feeds, make sure you put the baby back into their own sleep space. So that's the recommendation. So not in the beds like where, like you mentioned, there's excessive bedding and that sort of thing. So overheating is an issue, which is why we keep their heads uncovered. But it's about thinking about every possible scenario, every possible environment.
Great advice, of course. So we've got some wrap up quickly. If we say flat on their back,
Yes.
firm mattress, definitely something where we no excessive bedding in there, and then design spaces in your house that are safe sleeping spaces for baby, and try not to take them out of those places for sleep. So these are their sleep spaces, the designated sleep spaces, and let's sleep them in those spaces and not in other spaces which could put them at risk, which are not designed for safe sleeping.
Right. Exactly.
Yes.